Hello and welcome. In this video, we will be demonstrating the use of Co-Seal, a synthetic surgical sealant. Co-Seal, a synthetic hydrogel designed to act as a sealant around a sutured site in cardiovascular and thoracic surgery and in patients undergoing cardiac or abdominopelvic surgery to reduce the incidence of severity and extent of post-surgical adhesion formation. Co-Seal is indicated for sealing suture lines along arterial and venous reconstruction, enforcement of suture and staple lines in lung resection procedures, patients undergoing cardiac surgery to prevent or reduce the incidence, severity and extent of post-surgical adhesion formation, patients undergoing laparotomy or laparoscopic abdominopelvic surgery as an adjunct to good surgical technique intended to reduce the incidence, severity and extent of post-surgical adhesion formation. Please refer to your own country's PI. Do not use Co-Seal as a bronchial stump sealant during bronchial sleeve resections or for sealing decorticated lung areas. Do not use Co-Seal in procedures in which pleural adhesions are desired. Co-Seal and its accessories are latex-free. Labels are provided on the packaging and can be used for patients' notes. Co-Seal is supplied as a sterile single-use. Co-Seal must be used within 2 hours of preparation. Do not remove the syringe clip. Using aseptic technique, open each pouch and transfer contents into the sterile field. Prepare the liquid and powder components as follows. Remove the luer cap on the transfer port closure. Do not remove the syringe clip. Rotate the syringe clip away from the other syringe plunger. This will allow ease of transfer between liquid syringe and powder syringe in step 3. Remove the luer cap from the powder syringe. Connect the powder syringe to the opening on the transfer port closure. Transfer the liquid into the powder by forcefully depressing the plunger. Mix contents back and forth between the syringes until the solid is completely dissolved, at least 20 times. Push the entire contents into the syringe contained in the syringe housing. Disengage the powder syringe by detaching the transfer port closure as follows. Grasp the powder syringe barrel. Press the levers on the syringe housing. Pull both the empty powder syringe and transfer port closure from the housing. Holding the syringe tips up, level syringe plungers and rotate the syringe clip to connect to the other plunger. Hold syringe upright and expel all air. Snap the applicator onto the end of the syringe housing. Co-Seal is now ready to use. Dry all surfaces prior to application. Hold the applicator tip approximately 3 cm from the site. Apply sealant forcibly to enhance mixing. Move quickly along the anastomotic site. Apply a uniform layer of sealant to the treatment site. Following application, wait 60 seconds before restoring circulation, applying irrigation, blotting the gauze, or touching the sealant. If the treatment site fails to seal, dry the surface. Reclamping the vessel may be required to dry the field for reapplication of Co-Seal. Reapply sealant. Do not disturb the sealant. If the sealant does not seal, flush the site with saline, aspirate, and use standard treatment. If the applicator becomes clogged, replace it with a new applicator as follows. Press the rib surface of levers on the syringe housing and remove the clogged applicator. Attach the new applicator. For use in adhesion prevention, use a spray device. The spray device will be covered in another in-service. Co-Seal swells up to 4 times its volume within 24 hours of application, and additional swelling occurs as the gel resorbs. Therefore, surgeons should consider the maximum swell volume and its possible effect on surrounding anastomotic structures potentially sensitive to compression. Do not inject into vessels. Do not use in place of sutures, staples, or mechanical closure. To prevent any compressive effects in compression-sensitive cavities with an increased risk of compression, for example, neonatal cardiac procedures, application of a thin layer of product is recommended, 1 ml per 10 centimeters squared. Thank you for watching this presentation on the use of Co-Seal. We trust that you are now aware of all the benefits and best practices for this product. Should you have any questions, please contact your local Baxter representative.